So this video is for all of my researchers out there looking for the answer to bone health or reversing osteoporosis on the internet. And I totally support you doing this because doing it on your own, finding the answers, doing the research is critical to your success. You have to be an advocate for yourself. But there's a lot of challenging information to wade through in the world of bone health. Bone health has a lot of controversial areas in it. So today I'm going to talk about one particular tool that I see a lot more people using, which is great, but I'm going to tell you why I have to be careful. So the tool that I'm going to talk about is ChatGPT. Now, ChatGPT, for those of you who aren't familiar with it, is AI. It's artificial intelligence, but it has gotten really good at helping people to wade through information. So I'm going to talk to you about how I use ChatGPT, but what I'm really going to do is go through asking ChatGPT some questions that I often answer, and I'm going to see what it answers so I understand what people are getting from AI on the internet about osteoporosis. So if you're thinking about using this tool, or if you've used this tool and you've used some of the information from it, please stick around because I'm going to show you some of the things that it does relatively well and some of the things that it does absolutely poorly. So stick around and watch this because we need a little clarification here. Okay, so I love AI, actually. I use ChatGPT for scripting these videos because it does help me to consolidate information. It's actually a really cool tool. But with AI, you have to be careful because if you just believe what it says, you can really be misled. I never believe when I ask it, hey, what is the research behind this topic? Or, very specific things about certain studies. It seems to find information somewhere that doesn't actually agree with what I'm asking it about. So there's a lot of room for error when it comes to asking AI questions. So I'm going to give you some examples of that, specifically about osteoporosis. I'm going to go through some one-word answers from ChatGPT about osteoporosis. Now let's start with probably one of the most important topics in the realm of bone health, which is what is the most important consideration for women with osteoporosis? And ChatGPT's one-word answer is prevention. And man, I couldn't agree more with that. Now, the follow-up question could be, how do I prevent this? That's a very long answer. The most important part here is timing. And of course, we restricted it to one word, but the timing is as early as possible. I think everybody should be getting some kind of screening, either at peak bone mass or for women as they're entering into perimenopause and the menopause timeframe. We need to understand what your bone mass is to begin with so that you know how aggressive you need to be with your therapy as you're going through it. All right, now the next question is a fun one. The next question we asked is, can osteoporosis be reversed? And it said, partially. I don't even know what that means, but I would strongly disagree here because obviously we see it reversed in our practice frequently. And by reversal, what do I mean? It just simply means that you, by definition, you have a T-score of less than or more than negative 2.5, depending how you look at it. And so by definition, osteoporosis is a T-score less than negative 2.5, meaning negative 2.6 or below. And if you now have a T-score of negative 2.4, you technically don't have osteoporosis. That doesn't mean you don't have a problem. It just means that you don't have osteoporosis by definition, and we can continue to work on your bone health with less and less concern of fracture over time. So in my opinion, can osteoporosis be reversed? The answer to that, ChatGPT, should be absolutely. Now, the next question is kind of fun. We asked it, what is the most important supplement to take for osteoporosis? What do you think it said? If you said calcium, you're right. So calcium is the recommendation from the National Osteoporosis Foundation. It's the recommendation from the World Health Organization. It is a common recommendation for people with osteoporosis. However, is it the most important supplement? No, because a lot of people don't take calcium and they improve their bones just fine. So calcium is not required to improve bones. It's actually relatively easy to get enough calcium through diet, assuming you consume some form of dairy. And even if you don't consume dairy, it's still actually not that hard to hit 700-800 milligrams of calcium per day. Whether or not you're absorbing it, totally different question. That's why you might need some help. But calcium, in my opinion, is not the most important supplement for osteoporosis. So then you might be asking yourself, well, what is the most important supplement for osteoporosis? It's going to really vary person to person. I think most people are going to end up on some form of a multi-mineral. It just may or may not include calcium. Boron is a really important part of that. Magnesium is a really important part of that. Some people just need more magnesium and they have all the other things. I think the fat-soluble vitamins are really important. The D, the A, the E, the K, all in the correct forms and the correct amounts. For some some people, it's omega-3s to help with inflammation and improve their omega-3 to 6 ratio. For some people, it's B vitamins. They're woefully B12 deficient or folate deficient, and they need improvement with lowering the biomarker homocysteine, improving methylation. For other people, it's going to be androgen support. Do they need DHEA or pregnenolone or some other thing to help raise their testosterone levels naturally? So it really would vary a lot person to person, but is the most important one calcium? I don't think so. All right, now this next one is fun. The next one is, do you need medications to build bone? And it says yes. I'm going to say, that's totally wrong, ChatGPT. Come on. No, you don't need medications to build bone. If you look at our population of patients, less than 1% are on pharmaceuticals for bone health. We see improvement in bone health, depending on how you measure it, pretty much across the board. We do also see reversal of osteoporosis. We see people have tremendous, 10%, 18% improvement in bone mineral density without drugs. So again, ChatGPT on this one, absolutely wrong. Now, the next question we asked it is, what is the most important contributor to bone strength? And it said exercise. So I like exercise. Obviously, you hear me talk about it. You see me do it. If you follow me on Instagram, I think exercise is important. Resistance training is what most people talk about when it comes to osteoporosis, and that's important. But is resistance training going to actually improve bone strength? Not really, not directly. It'll improve muscle mass, but in order to actually stimulate bone to grow, we need impact. So really the answer to this question, if you were to ask what is the most important exercise contributor to bone strength, I would say impact. If you just said what is the most important contributor to bone strength overall, I'd probably say nutrition or diet, because without the right building blocks, nothing else matters. So interesting answer there, ChatGPT. All right, now the next question we said is, what is the most important lifestyle factor for building bone? What do you think it said? It said weight bearing. I'm assuming it meant weight-bearing exercise, and it tried to get away with hyphenating that word so that it had a one-word answer. But weight-bearing, and weight-bearing is important. But we see this mistake all the time. Is weight-bearing exercise like walking, is that going to improve bone mineral density? No. Could it slow it down? Yes. So weight-bearing, important, but weight-bearing not going to reverse osteoporosis. So probably just need more than one word there, ChatGPT. Now the next question is super fun for me. It is, what is the most important nutrition factor for osteoporosis? Now this is cool because it said calcium, as I would expect it to. I would not say calcium. Yes, we need the mineral building blocks, but again, they're relatively easy to get. What we need is protein. Bones are 50% protein by volume. So we need to focus on protein. So many people with osteoporosis are deficient in protein, deficient in calories. They don't have the building blocks. It's not more calcium in their diet that they need necessarily, probably more protein and more overall calories. All right, now this next one I agree with. We asked ChatGPT, will hormone replacement therapy help build bone? And it says, yes. Good, thank you. I'm really glad it didn't say no. All right, now back to lifestyle. We asked it, what lifestyle factor most negatively impacts bone? And it said smoking. And that's pretty true. There's not a lot of evidence behind smoking and osteoporosis, but we know that smoking does have toxins in it. Specifically, I believe it's cadmium that is in cigarettes specifically, and that is pretty toxic to bone. So there's a lot of negatives that go along with smoking. I don't think a lot of people watching this channel are smoking at this point, but apparently, according to that lifestyle factor question to ChatGPT, smoking is the worst one. I could think of some others, but smoking's pretty bad. So I think we'll just leave it at that. All right, now one of my favorite topics to talk about, the alkaline diet. We asked ChatGPT, what do you think about the alkaline diet for osteoporosis? And it said debatable. Not in my world, but it is debatable because there is lots of debate. So lots of advocates for it. And then obviously I'm an advocate, not necessarily against it, but just that it doesn't matter. So debatable, sure. Yeah, okay, I agree with that. Now, the next question sort of goes back to one of the other exercise responses. We asked it, what do you think about impact training for osteoporosis? And it said beneficial. I agree. Beneficial, as long as you don't get hurt. So you have to be careful. And then the last question we asked it is, does eating animal protein improve bone health? And the answer was, yes, absolutely it does. Study after study shows more benefit from animal protein than plant protein, specifically for bone mineral density and fracture risk. I have so many other thoughts in here. Okay, so I just expanded on that last one. So I'm sure a lot of people who are eating a vegan or vegetarian diet, if they're watching this, are saying, well, what about plant protein? Okay, fine. So I asked ChatGPT, does plant protein improve bone health? And the answer is yes. And that is true depending on your starting point. The next question, which is a fun follow-up, is which is better, animal or plant protein for bone? Guess what it said? Animal. All right, so I could go on and on and on about ChatGPT and some of the funny things that it says that are incorrect. My point is with creating this video is that something like AI, this tool is going to gather the wealth of information that's on the internet and condense it into, for example, here, single word answers. This is why you have to be so careful in your search, because where you're sourcing the information from is absolutely critical. If you have a bias towards something, you will find somebody saying that that thing is good. It is out there, I promise you. So you really have to look for people who are talking in an unbiased way as much as possible. We're all human, but being objective and trying to help people to achieve the goal that you're trying to achieve. Okay? So be careful with ChatGPT. It's an awesome tool, but it has to be used in context, and any specific thing that it's telling you to do, please verify it with other sources. All right, that's all I have for today. If you are interested in joining a community of individuals who are using not ChatGPT, but other tools to help to improve their bone health, please consider joining our Healthspan Nation. Healthspan Nation is an area where you can ask real people real questions, and they will give you real answers. We have our community, we have our topic-driven Q&A that we do on Zoom once a week with myself or a team member, and we are helping people to reverse osteoporosis in a DIY fashion through Healthspan Nation. So if that sounds good to you, check for the link in the description in YouTube, as well as go to our website if you're listening to this on a podcast, and go to optimalhumanhealth.com. Under the programs tab, you'll see Healthspan Nation there. All right, I'll see you in Healthspan Nation.